Aloha and welcome back to the Kupuna Connections television program. I'm Colin Hayashida with Kapi'olani Community College's Kupuna Education Center, and every week we bring you a different topic having to do with elder care, family caregiving training, and sometimes about active lifestyles for the active seniors. Today we have a very important topic to talk to you about, having to do with adult residential care homes and adult foster homes, and what is the potential? What is this as a potential as an alternative to nursing home care? And with me is Keith Ridley. Welcome, Keith, for joining us today.
Thank you very much.
Yes. So, Keith, can you start out by maybe providing a little bit of introduction as far as who you are?
Sure, I'd be happy to. Aloha. My name is Keith Ridley. I'm the Chief of the Office of Healthcare Assurance with the State Department of Health.
Okay, and so that means as far as care homes and foster homes, what's the connection there?
Well, the state regulates a number of healthcare facilities, and all of those facilities that are regulated and are required to be licensed are licensed by our office. The Office of Healthcare Assurance, or OCA as we sometimes refer to it, is the licensing body and the regulatory body on behalf of the state.
Okay, so you're in charge of making certain that they're licensed then.
That's correct.
And licensing, I guess, means that they're providing good quality care.
That's correct.
Right, okay, got it. So, we've got these terms that are floating around, and the community oftentimes gets a little confused with regards to these terms. They hear about nursing home care, of course, and obviously sometimes now, of course, they've heard about geriatric or adult daycare centers and that sort of thing. But adult residential care homes, adult foster homes, what are we talking about here?
We're really talking about a care that's provided in a home-like setting on a 24-hour basis. So you as a consumer, for example, will be in someone else's home, and that person isn't related to you by blood or marriage, and you're providing a fee to that person for the care that they're providing you. But the care essentially is done in a home-like environment rather than in a skilled nursing facility or an institution.
Okay, so this is not a nursing home. This is not a large facility per se.
This is not a large facility, but as we'll get into a little bit later, there are some services that can be provided at a skilled nursing facility level, and we'll get into that a little bit later.
Right, okay. Now, we brought some pictures along just so that people have an understanding or can see what some of these places look like. But let's take a look at one of these photos here. So this, I guess, is just an ordinary home then, yeah?
This is like a home that you might see in many neighborhoods throughout Hawaii.
I guess.
It is a regular family home, oftentimes, depending on the number of beds that the license is for. They may be larger homes, of course, or smaller homes, but typically these would be the kinds of homes that you would see.
I guess oftentimes a family is living upstairs and the clients are living downstairs or something to that effect?
That's correct.
Okay, and here's another photo here. These are friends of mine that had come from Japan and wanted to see one of these facilities. So I guess in this situation, the family is living upstairs, and there were a number of residents living downstairs. So again, here, as you mentioned, this is a regular home. Yeah?
That's correct, right.
Yeah.
And there are family members who are living there besides the caregivers, and so it is really a family environment in addition to being a home-like environment.
Right, okay, good. And then we've got this other photo here, and I guess this is just a bedroom here, yeah? Friends of ours and some former caregivers.
Yeah, this may be typically what you would see in an adult residential care home or even in an adult foster home, where the rooms are typically individual rooms, single rooms. They're clean, they're comfortable, and that's primarily where the resident will spend their time in addition to elsewhere in the home. In the living room with the family or in the dining room.
Oh, okay. And we've got another last photo here. I got another room.
This room happens to be one where there are two individuals. Again, you see that the room is clean. The floor is clean. It's a tile floor. A lot of sunlight coming in for natural light so that the residents have good light and fresh air coming into the room.
Yeah. I guess in the other photo, the bed was like a regular bed, and this one is more like a hospital type bed. You know, so a patient, a person in this situation might be a little bit more disabled, possibly.
Possibly, yes.
Possibly, huh?
Right.
Okay. All right. So that's an example, I guess, and people have then more of a feel with regards to what we're talking about here. Right. Okay. Right. Now, so what kind of care are we talking about that is provided by care homes?
Again, generally speaking, we're talking about care for someone who is relatively independent. So this would be personal kinds of care, assistance with daily living, or ADLs as we often call it. And ADLs, or this kind of care, would be more of a personal nature. Toileting, dressing, bathing, cooking, feeding, reminders about taking medications, providing outdoor activities or excursions to a mall or to some show of some sort. And so these would be the kinds of services that are typically provided at a level within the residential care home that someone requires.
Okay.
There are other services that an adult residential care home can provide, more of a nursing kind of a service, and those we'll get into, I think, a little bit later. But essentially, those are what we're talking about, relatively independent kind of care.
I see. So much of the service then is non-medical, I guess, you might say.
Yes, it's very much a social model, although there is certainly a medical component involved with it. Mm-hmm. There is supervision of the resident, making sure that visually the person is okay. Mm-hmm. If they need help walking or getting in and out of a wheelchair, that assistance will be provided as well.
Mm-hmm. Can you share anything by way of comparing it with adult foster homes? We hear about those as well.
Sure. Adult foster homes have one significant difference with an adult residential care home, and that is that an adult foster home is required to accept Medicaid recipients, Medicaid patients, and accept the payment that comes from Medicaid. That's really the primary difference. But otherwise, the services they provide are very similar. But it takes a little bit more of an explanation, if you don't mind. Sure. We've talked so far about an adult residential care home really being really providing the kind of care with assistance with daily living kinds of activities. Again, the toileting, the showering, and eating, and that sort of thing. An ARCH, an adult residential care home, can also provide care at a skilled or intermediate nursing level. These we call expanded ARCHs, or E-ARCHs. Mm-hmm. An adult foster home is more similar to an expanded ARCH than a regular ARCH, or non-E-ARCH, non-expanded ARCH. The foster home provides care mostly to individuals at a skilled level or a intermediate care level of care than a standard ARCH.
When you say skilled level, how do you, I mean, for the lay viewers out there, that word may kind of trip them up.
Right. Well, these are the services that we're more familiar with, for example, in a skilled nursing facility.
Nursing home.
Right, in a nursing home. And these would be services that are provided or required to be provided by a registered nurse and other therapists or other clinicians. So there may be physical therapy, speech therapy involved. Those kinds of activities are really at a clinical level that is higher in terms of need than a more independent person who may be at an adult residential care home.
Okay. So we're talking of different levels, and depending upon the kind of license, I guess, we're dealing with, you have different kinds of clients in
Correct.
These various types of
That's
homes.
Correct.
Okay. And some of which may be closer to a nursing home level, so to speak.
Yes.
Okay. So as far as these homes are concerned, you have, on the one hand, the adult residential care homes, much like what we saw in that photo perhaps, or the adult foster homes. We're talking also about regulations or licenses. Are they licensed or regulated?
Yes, they are. again, we're the regulating body for the state.
Right, okay.
And so the adult residential care homes and the expanded adult residential care homes are licensed by the Department of Health. The adult foster homes are certified by the Department of Human Services. So the oversight for both of these kinds of homes are done through separate departments. But next year, next July, the adult foster homes will be transferred to the Department of Health, and the Department of Health will become responsible for the oversight.
I see. Okay, so when the hospital says we want to transfer your mom to an adult residential care home or adult foster home, they can feel assured that these are licensed facilities. Yeah?
That's correct. Yes, they can.
Yeah. Okay, that's good to know. Now, you made some mentions. I guess we should get back to this whole. I mean, this whole area gets a little bit complicated, I think, for the lay public with all these different terms. But maybe we can get back to some of this again. That is to say, looking at the adult residential care homes, the care homes now, you mentioned two types, regular care homes and this E-arches, arch, I guess, is adult residential care home. Can you share a little bit more about that distinction?
Sure, I'd be happy to. The adult residential care home, again, we refer to them typically as arches.
Okay.
And expanded adult residential care homes, we refer to them as E-arches, are very similar. The major distinction between the two is that an arch provides care to someone who is relatively independent. And that care is more of a personal care kind of service. Again, cooking, providing toileting assistance, bathing assistance, feeding, and providing some kind of gait or even some kind of assistance with getting in and out of a wheelchair or walking. An expanded arch can also do those services, but they also provide care at an intermediate or a skilled level of care. And again, those intermediate or skilled level of care are the kind of care that are required to be performed by a licensed registered nurse.
Okay. All right. Then the other thing that we often hear about is we normally think about these care homes like we saw in the photo as a home. But I recall, many years ago, I used to work at Kokini Hospital and Kokini Medical Center, and there once was, there is a residential care home. And it's fairly large in terms of the numbers of people. And then, of course, from Kapi'olani Community College up the street in Palolo, we've got a Palolo Chinese home. Again, pretty big. So are they small? Are they large? What do you say?
You're asking about the arches and the E-arches.
Yes.
They can be a variety of sizes. Again, we've talked about the two kinds of arches.
Okay.
An arch and an E-arch.
Okay, right.
There are also a couple of other distinctions.
Okay.
You can have an arch which is a type 1 or an arch which is a type 2. Similarly for an E-arch. You can have an E-arch which is a type 1 and an E-arch which is a type 2. So what are these types?
Yes, what are they?
The type refers to the number of beds that they're licensed for. So a type 1 facility or home is licensed for 5 or fewer beds, while a type 2 is licensed for 6 or more beds. So an arch, type 1, is an arch that's licensed for 5 or fewer beds. An E-arch, type 1, is an expanded arch which is licensed for 5 or fewer beds. Similarly, an arch, type 2, is an arch that's licensed for 6 or more, and an E-arch, also 6 or more beds.
Okay. To simplify it, I guess, they're bigger ones and smaller ones.
They're bigger ones and smaller ones.
Okay, and then they have different licensing requirements, I guess.
The requirements are very similar, but there certainly are differences, again, because of the kinds of care that can be provided in those facilities. There are additional requirements.
I see.
For a facility or a home that's licensed as an expanded arch, either type 1 or type 2. Right. Now, let me also add, because I talked about the numbers of beds and the differences between an arch and an E-arch, and that is that, again, we want this to be more of a home-like environment, not an institution. And so an expanded arch, for example, can provide care at an intermediate or skilled level, but only to a limited number of their residents. Again, so that it's not the entire facility that's at that level of care. So a type 1 E-arch, right, 5 or fewer beds, will have no more than 2 beds at a skilled or intermediate level. So most of the beds are really more at a more independent level of care. Similarly, with a type 2, no more than 20% of the beds. Again, we don't want the entire home to be full of the skilled level or intermediate care residents.
Otherwise, it would be like a nursing home.
Otherwise, exactly, it would be like a nursing home.
I see. So when you say to make it home-like, how do you sort of encourage them to make it home-like? Are there certain things that you try to suggest that they do?
Well, typically these are actually homes, like the photos showed.
Right. Okay.
This is a home rather than a large facility. Although there are a couple of larger facilities, of course, and so we encourage more communal type eating. The caregiver lives in the home, and as I mentioned earlier, also very often the family will live in the home, perhaps upstairs. So the family is there. It's in a neighborhood with other homes. And there may be children playing and dogs barking and that sort of thing, which really makes it much more of a home environment. Right?
Oh, I see. Okay, got it. Now, are there many of these residential care homes and foster homes in Hawaii?
There are a good number. We have over 500 arches, which include the E-arches, throughout the state. Mm-hmm. So it's a pretty good number, and the numbers increase. They've increased regularly over the past several years. Similarly, for the adult foster homes, there are over 1,100 of these homes throughout the state.
Wow. Okay. So people that need access to 24-hour residential type care should not really have too much of a problem in finding something then.
They shouldn't. It may depend on their geographic location, of course, because we would expect, that there would be a distribution more in line with the population.
Sure.
So perhaps in some rural locations on a neighbor island, there may be fewer than there would be in urban Honolulu, for example.
Right, right. Now, let's talk about cost. I mean, obviously there's great variation from one facility to another or home to another. But is there any kind of thing that you can share with us about, the average cost or what people can expect when they go out looking?
I really can't. And it's only because the cost that someone will charge a resident isn't regulated by the state.
Okay.
So it's important for anyone who is looking to live in an arch or an E-arch or an adult foster home that they carefully talk with the licensee, with the operator and the caregiver to determine what those costs are. So because we don't regulate it, we don't have fee lists, we don't know what they charge. We hear a variety of fees and they're quite wide. And so it's really important for the consumer to spend some time and discuss those fees with the individual care homeowner that they are considering going into.
Yeah.
The difference again with the adult foster homes, as I mentioned earlier, they are required to take Medicaid recipients and Medicaid payment. So that's the only situation where there is regulation over what is charged. It's essentially at that Medicaid rate.
So the adult foster homes then, as far as the consumers are concerned, or the family members that are trying to provide placement for their parents, would essentially be free if they qualify for Medicaid. Would that be the case?
Well, I probably so. I'm not a Medicaid expert, and so that's really something that is under the legal authority of the Department of Human Services. But typically, many of the services that Medicaid does pay for are provided without a co-payment or a deductible from the recipient.
Right. Unless, of course, they need to provide a certain amount of, out of their own pocket in order to qualify for Medicaid or something to that.
That's right.
Yeah, so there may be some issues there, of course. Right. But generally speaking, we're talking about Medicaid paying the bill.
Correct.
I see. Okay. So now, well, I'm sure that the viewers out there will probably need to come up with a list of questions before they go and see some of these facilities and these care home operators or foster home operators, just so that they can use the time wisely and make some comparisons. But of course, just having someplace that's cheap doesn't necessarily mean good. Of course, so they've got to be certain about the quality issue.
Sure.
Yeah. So going to quality, then, how do we assure quality care in places like this? I mean, maybe are there some minimum qualifications that you require so that the care home or the families that are seeking these types of facilities for their parents or their loved ones can be assured that they've met some minimum standards? Are there some questions that you can suggest that they ask? What can you say with regards to this whole quality assurance issue?
Well, let's talk about the requirements to be licensed.
Okay.
And there's a lot that's contained under that.
Okay.
As I mentioned earlier, by law, any adult residential care home is required to be licensed by the state. So I think the first question that a consumer may want to ask for is, may I see your license?
Good. Okay.
That would be the first thing.
That's the first one. Okay.
The second thing that they might want to ask for is, may I see a copy of your last inspection report? And these are things that the care home operators should be very willing to provide, because these are things that are part of their licensure. Okay? The care home survey report or inspection report is a matter of public record, and we encourage all of our licensees to make those reports available to anyone who would like to see it, who's considering going into their home. So those would be the first two questions that I would suggest that a consumer ask any care home operator that they're seeking to be admitted to. Okay.
Oh, okay.
But there are a number of requirements that that a licensee is required to comply with before they become licensed, and it's all about the primary caregiver qualifications, the staffing and family requirements, admission policies of the resident, what kinds of activities of daily living, I touched on that a little earlier, activities of daily living services are provided. Does the home have a disaster preparedness and emergency care plan?
Mm-hmm.
What about nutrition? What kinds of foods do they typically prepare for the family? We also look at food sanitation. Is the food stored properly? Are the dry foods stored in a dry area? Are the frozen foods stored in a proper freezer, or refrigerated properly, or heated properly and cooked to the appropriate temperatures? Those sorts of things. Medication. How is medication labeled, and how is it provided? Again, for an ARCH, the ARCH caregiver isn't allowed to administer medications, but they can tell the resident, oh, it's time to take whatever medication you might have.
Mm-hmm.
Okay?
Mm-hmm.
And so the resident would take the medication. We also look at what the personal care services are that are being provided, what kind of recreational or rehabilitation programs and social services are being provided to the residents. We also ensure that the resident has rights for the care that they provide. Rights for privacy, for example, and rights to be informed about the care that they are receiving, or the care that needs to be changed, perhaps, that they're receiving. There are also requirements on the physical facility. How wide are the hallways, the doorways, the rooms? How big are the windows? We saw in that one picture earlier where a lot of sunlight coming into the room. So how big are the windows?
Well, there's a lot of questions that you make certain that are answered in order to make certain.
There's a lot. There's a lot.
Yeah. And so I think the first thing that you pointed out for our viewers, check to see whether or not they have their licenses, and whether or not you can see their last inspection report would say volumes, I suppose.
Right.
Yeah.
Right.
And that should be accessible to the.
Oh, absolutely. I think if I were a consumer and I were to ask for a license, or if I were refused to see their last inspection report, I think I consider another facility.
Okay,
Another home.
Good point. Now, what about the inspections? How often does the health department do these inspections?
These homes are inspected every year.
Annually?
Annually.
Oh, okay.
And we have the legal authority to go in more than that if we feel it's necessary to.
Okay.
And oftentimes we do. We go for follow-up. So when we do an inspection, and if we see some deficiencies, as we call them, and the deficiencies are corrected, we may go in another couple of months later to make sure that the deficiencies didn't reoccur.
Okay. Now, we have this one slide up here with regards to contact information that I wanted to share with everybody. Perhaps you can kind of share with us a little bit about what these are.
Sure. For the adult residential care homes, we do have a lot of information on the Department of Health website, and you can view that information at the hawaii.gov.health. And again, the regulations that I alluded to earlier are on there as well, as well as the listing of the adult residential care homes.
Okay,
so you can see, right. Okay. And if anyone has questions for us about particular homes, they can call us at the Office of Healthcare Assurance on Oahu, 808-692-7400. And for the foster homes that, again, are currently under the responsibility of the Department of Human Services, you can call 808-292-7233 here on Oahu to talk to their certification contractor. The Department of Human Services has a contractor that does the certification inspections.
Okay, this is really good. So I'm sure that our viewers had enough time to write that down. But, well, we're just about running out of time right now, so I thought maybe, given the tremendous amount of information that you shared with everybody, if you could provide them with one last tip, what would that be? Sure,
and I mentioned it before as well, and that is that if you're considering a care in a adult residential care home or in a foster home, ask to see their license or ask to see their last inspection report. But I think the other thing is that for a home that is licensed, the public can be assured that the state is safeguarding the public by conducting inspections to ensure that every licensee is in compliance with the licensing requirements.
Thank you very much, Keith Rudley from the State Department of Health. Very important information for our community out there that is oftentimes very concerned about placement for their loved ones. So again, thank you for watching the Kupuna Connections television program, and see you again next week. Aloha.